Okay, well, good evening and welcome everyone to tonight's In Conversation Live with Baroness Sheila Hollins. I'm Henrietta Bowden-Jones. I'm President of Psychiatry and Council Member, about to become Vice President of the RSM from the 1st of October. And as a long-standing admirer of Sheila's work and of Sheila as a person, it's a great honour and privilege to be able to interview her tonight. This session is very interactive. In fact, I think most of you have been online listening to our ICLs, and you know how many questions come through. So we will have to make do with me stopping every now and then and asking people to contribute. But please do, because I think part of the pleasure that we get from the sessions is that people can give their thoughts and ask opinions. So the session will be on YouTube later. I just need to let you know in case anyone wants to see it again. Right, well, let me just read a little bit about you for people's, everyone knows you anyway, but Baroness Hollins is the Beyond Words founder, chair of trustees and editor of the series. She's Emeritus Professor of Psychiatry of Intellectual Disability at St George's and sits in the House of Lords as an independent crossbench peer. She's currently President of the Royal College of Occupational Therapists and President-elect of the Royal Medical Benevolent Fund. Sheila has advised the government on the development of many initiatives and policies. She was a founder member of the Pontifical Commission for the Protection of Minors. She's a past president of both the Royal College of Psychiatrists and the BMA, and past chair of the Board of Science at the BMA. So welcome, Sheila. And we're going to start by getting you to tell us a little bit about the fact that you were part of British history recently as you attended the Queen's funeral at the weekend. Would you like to share a bit about your experience with us?
Thank you, and well, thank you very much for inviting me, Henrietta. It's, I mean, I think the RSM has done a fantastic thing. What a gift to the medical profession and more widely to have so many events right the way through the pandemic and now to continue them. I actually am the president of the Royal Medical Benevolent Fund, and it was in that capacity that I went to Her Majesty's funeral, not because I'm a member of the House of Lords. It was because the RMBF is a charity that the Queen had been patron of for over 70 years. And she was very keen that at her funeral there would be people there who were representing the charities that were dear to her heart. So it was a real honour to be able to go. It meant getting up very early. I sort of tossed up, should I try staying in London? But, you know, I would have had to walk there from wherever I was anyway. And walking from Vauxhall Station at 7 o'clock in the morning didn't really seem that bad.
What was the atmosphere like?
It was well, I was there. I was seated by 8:15. The police presence was extraordinary. I mean, I walked past. You know, my office in Parliament had been taken over for security reasons. I hadn't been able to go inside, but to walk past beneath my office and to go through security to get into the Abbey. But then once inside, it was very relaxed. Very quiet, very respectful, and just sitting waiting, and music was being played the whole time. It was a lot of time for reflection, really, about our late Queen, and you know, quiet conversations with people who were there about, you know, their reasons for being there. And then the very dignified procession, and it was right there in front of us in the nave, you know, people walking, seeing Prince William, really, you know, his lip quivering as he walked, you know, just really feeling for the family who were mourning in such a public way. Yeah. It was a very beautiful service, and
do you feel that the unanimous response of mourning of the country was in part a apart from the respect they had for the Queen. But was there a need to be unified somehow after the divisive political events of the last months? I don't know. I mean, you have a political role. You have you're a psychiatrist. You're probably the only psychiatrist in the whole of Westminster. What are your thoughts about combining your two?
I'm not the only psychiatrist, actually. There are a few. There are at least 2 MPs, and there are 2 other peers who are psychiatrists, although they tend not to speak on mental health issues. Well, I think people wanted to be out and to belong, and I think part of it was a post-COVID thing. I think it was partly that people, we actually went to the lying in state, and just seeing everybody queuing, and the friendships that were being formed, and that need to be part of something seemed to me to be really important. And I was struck by a number of things. And one is this was a woman who was a deeply faithful Christian. Okay, the service was a Christian service, and people were there singing, participating in a religious service when that might not actually be part of their ordinary reality, their normal reality. So there was that element to it. I felt also that there was something about the fact that she had been Queen for very few people would have known anything else. She's been Queen for people's lives. And for me, there was something really important about it as well, because reflecting on it, I saw her coronation on television, the very first time I saw a television, little tiny black and white box, right, in a neighbour's house where I was allowed to stand behind the sofa and peer over and watch these black and white figures. And as I was growing up, I can remember thinking, we didn't get a television until I was about 15, but I can remember thinking, what would it be like, if there were women reading the news? What would it be like if there were, women having discussions and having opinions? And the only woman who was visible in a leadership position was the Queen.
That's so interesting, right? That you have. I remember you mentioning the 1960s. You were talking about late 1950s and 1960s, and she was the she was the one. I mean, there were a couple of others who were beginning to emerge in television. That was The Week That Was. Does anybody here remember that? Great fun, right? There was a woman on that, right? But literally a handful of figures in. Where were the women? Yes, see? And I can remember sitting there thinking, I don't know how you would dress, I don't know how you would speak, I don't know whether anybody would listen to you. And of course, when I went to St George's, I can remember I was sitting on the academic board, and there were 2 other women there, colleagues from St George's will remember them, June Lloyd and Joan Bicknell. And I can remember speaking once, and nobody listened to me. Nobody said anything. About 5 minutes later, one of the men there said what I just said. Oh, what a good idea. Well, you're preempting a whole conversation about those days, which I will get on to, because I think and I know, because you and I have chatted about this over lunch one day, and so you have some very interesting stories about those times. But just going back, last moments, in terms of reflections, I did find several patients in tears, and in the days following, and trying to understand exactly what it meant to people individually. Yes. People kept on saying, but you see, she meant stability and she cared. And I was fascinated and touched also by the fact that here were all these people, waiting for their NHS treatment, needing to be seen, suffering, waiting for, and yet, they were deeply, deeply impacted by the stability offered.
Because she was somebody who lived a life of service, and she did it cheerfully. Yeah. I don't remember seeing a photograph of Queen Elizabeth with a frown, complaining, oh, not again. Oh, not another hand to shake. She didn't, did she? Yeah. She really did dedicate herself in a way which is, quite saintly, really. And I think I think it was for her a kind of covenant that she made to do that, and I think that touches people profoundly. But there's something also about the fact that I had a colleague who's a constitutional historian in the House of Lords talking about how he thought that this was, if you like, the end of the post-war period.
Yeah.
And that we've been through a lot, but actually there's something changes with her death.
So a collective mourning, really,
a sort of
the end
mourning,
of something that we've all shared.
Yes, but also that it gave people permission to grieve, again for their own losses.
Yeah.
And I think sometimes when there is an occasion like this, that's what happens, that it's giving permission.
Yeah.
It's giving permission to grieve. And I was talking to a couple of colleagues yesterday, and one of them was he was in tears as he spoke about how he felt seeing the orb and the sceptre and the crown taken from the coffin and put on the altar, and how that kind of really was the moment when we realised that the symbols of her authority had gone, handed over,
Yeah.
and what a profoundly moving moment that was. And I agree. I thought it was. I did see that.
Well, thank you so much for sharing these very special moments that you lived through. When we were preparing for today, I asked you to think about something that you really cared about, and that we might discuss that before we go on to your childhood and your parental influences and things that are very interesting. But I thought, what can we discuss to really get into it? And we talked about the fact that the Mental Health Act reform, in particular the delayed discharges in mental health settings, have been something that you've really felt passionately about. And I'd love you to tell us about the legal issues around those delayed discharges from hospital of individuals with learning difficulties and even more generally complex needs. Maybe some people here won't know as much about it in terms of maybe not having lived through some of the psychiatric side of things, but maybe tell us a bit about why this is so relevant to you and to the country, really.
Well, so the 1983 Mental Health Act was seen as being kind of a more liberal act than the previous act, and there was great hope. But when I became president of the Royal College of Psychiatrists, there was a new attempt to reform mental health legislation, and it was actually the Labour government who were doing it. And they wanted to essentially make it easier to detain people. And they also were introducing community treatment orders. And it did seem at the time to the Royal College that this was largely in response to kind of media pressure and concerns because there'd been some high-profile homicides caused by people when they were mentally ill. We were kind of working things out and saying, well, how many people would you have to detain with a psychosis, for example, in order to prevent one death? And, the estimates were sort of 20,000 people or something, right? So it didn't really seem a very sensible thing. It seemed that better services might be, better support for people, better community services might be better. The community treatment orders haven't been a great success, really. And it does seem that more and more people are being detained under mental health legislation in hospital, whether they have a psychiatric illness, a mental disorder as defined under the mental health legislation, or whether they are people with learning disabilities and autism. And this is where my particular interest is, because if you have a learning disability or you're an autistic person, child or adult, the point about it is that if without necessarily having a mental disorder, if you are considered to be a risk to yourself or to other people, if your behaviour is particularly challenging to service providers who really feel they don't know what else to do, you can be admitted and detained under mental health legislation. If you have you are in hospital involuntarily with a mental illness, the average stay is something like 28 days. But if you have a learning disability or autism and you're detained, the average stay is something like 6 years.
6 years.
Okay, 6 years. So that's what we're talking about. Delayed discharges is one way of putting it. Yeah. And I use that term because you'll read in the papers about delayed discharges, and everybody thinks it's applying to kind of elderly people who've gone in for a hip replacement and then they can't go home and there's a problem with social care, or they've gone in for, a medical procedure or treatment and they can't go home. And so there's a delay because there's a problem with adult social care, and we haven't brought health and social care together, okay, which we should have done, but we haven't. And there's talk about it, but nobody ever deals with it. And people think adult social care means old people, They think it means, me when I can't look after myself and need to be put somewhere, that adult social care is about old people's homes and why shouldn't I pay for it myself? The majority of adult social care is actually with adults of working age.
It's so important that you're telling us this, because I'm sure plenty of people like me had no idea about this.
Yes. So the actual cost of adult social care for people who are of working age is at least the same as, and maybe higher, than the cost of care for older adults.
Wow.
Who may need social care. So the issue is, and so I've been doing a piece of work for the last almost 3 years now. It was supposed to be a 1-year project to oversee a program of independently chaired care and treatment reviews of people who have been detained not only in hospital but actually in segregation, if you like, in solitary confinement. That's quite a strong word to use, but they are being looked after in a room on their own with no contact with peers, often with no outside, fresh air, without any choice about how they spend their days, often without adequate toilet facilities. And yes, there are some circumstances where people are being detained in a segregated environment, which is kind of a more pleasant environment, where they do have outdoor space and so on. But the people we've been looking at, there are 117 people. One of these is about to be discharged, but it took a court order to get him discharged. And still the placement he's been there for 20 years.
Gosh.
His parents are in their 80s. They've been visiting him 100 miles away every week.
Why 100 miles away? Because no facilities could be found by the clinical commissioning groups or the local authorities. Where is the problem?
Right, so the problem is that the local commissioners haven't known how, in my view, to commission the right services. And so they wait until what they call the last resort, and people are admitted as a last resort, usually on a Friday night, when the care providers think, fine, well, they're going to have to admit now because nobody's going to do anything else at a weekend. Yeah. And 5 years, 6 years, or in this particular man's case, 20 years later, the prospect of a discharge. And 100 miles away because there are no local facilities. But also, when the long-stay hospitals were closed and that programme of closure began, the proposal was, and this is always the problem when legislation or when there's a policy which is introduced but without the underpinning, which would make the policy work. So you can close hospitals, but if you don't actually then provide adequate community support, then it's not going to work.
Yes, without the facilities in place already.
Yeah. And you could be quite cynical about it, really. But and I can remember I had a policy placement in the Department of Health in 2001, which was when a very important white paper called Valuing People was published. A visionary paper, really important. But I can remember pointing out to ministers at the time that if we didn't actually implement it properly, the private hospitals which were beginning, even at that time, to be built, would continue. And there was one organisation which was building a 24-bedded unit every year. Okay? And there are several private organisations that have been developing small units all over the country, paid for by the NHS or by social services, to detain people who could actually live in the community if we developed social care.
So this is where the 820 million a year is going. to these private facilities as we speak. Wow. Wow.
So delayed discharges has a very particular meaning in mental health services and in learning disability and autism services. And it's the lack of social care, which is...
Yeah. How do you think things will evolve under this new government?
Well, so there's a draft mental health bill. And Simon Wesley, of course, chaired the review to propose how the mental health legislation should be changed. And actually, fascinatingly, the original focus was to be on inequalities, particularly racial inequalities. But I think there's, to be honest, a missed opportunity, because I now sit on the pre-legislative scrutiny committee, which is a joint committee of both the House of Commons and the House of Lords. I have written about the fact that I believe that learning disability and autism should not be a reason for detaining somebody under the Act. However, and although the proposals might make some things better, and it may be that actually still being able to detain people under Section 2 for assessment would be sufficient to mean that commissioners started commissioning proper community services. There's a real risk, which is that the Mental Capacity Act could be used instead of the Mental Health Act, and it has fewer safeguards. And people may not realise, but we have these two acts sitting side by side, but the interface between them doesn't work. It's not understood. There are really serious risks that if without bringing the two together to create, a modern... I mean, if we had started with a blank sheet of paper and said, look, this isn't working, let's start again, then we might have a chance of sorting this out.
Yeah. So that would be one possibility for the future eventually, in theory.
Yes.
Who are the champions? Who do you feel are the people who truly understand this, and in government or in health? Does the health secretary understand this?
What, our new Secretary of State? Therese Coffey is a chemist, I think, by background. I don't imagine that she knows very much about mental health legislation. The minister that we were working with, Gillian Keegan, understands it very well now. But the trouble is, if you change minister just at the point when you're introducing a new draft bill, that's a really bad thing to do, because this is complicated. This is really complicated. Really complicated.
So less than optimistic, you might say.
I'm worried about it.
You're worried about it.
I'm worried about it, and I'm not
Yeah.
sure that I would be able to continue to support having, learning disability and autism being an insufficient reason to be detained, because the alternatives without adequate provision. There is one good bit of news, which is that in the Health and Care Act that came into force on the 1st of July this year, a number of us were able to argue successfully that commissioners, there would have to be a named commissioner for each integrated health board who would have responsibility for commissioning services for people with learning disabilities and autistic people. And that means that they're going to have to be trained, they're going to have to make sure that they appoint the right people, because they will be held accountable.
Yeah.
We hope, we don't quite know how that's going to work, but if they are held accountable, there is a chance that recommendations will be taken note of. So at the moment, and this is in the public domain, but the independently chaired reviews that I've been kind of overseeing, the recommendations up until now have largely been ignored by commissioners.
We're going to go on to our Q&A in a second, but talking of ignoring recommendations, do you have any thought about the neglected 30 obesity strategies that have been sitting on people's desks, government after government? What do you feel is happening to the nation in relation to the competing arguments of this is a nanny state, don't decide for people's individual freedom of choice, and look after the vulnerable, they need our help, they don't want to live in a toxic environment? What are your thoughts around this?
I mean, you mentioned obesity.
Yeah, I'm
Yes,
focusing
yes,
on. I could
yes.
mention gambling, but obesity is probably a more.
No, I think restricting the sugar content of food is a really good idea. I don't see that as being nanny state at all. And I think that there are some things which are just common sense actually.
Yeah.
And the health of the population, if there are some simple things you can do, why wouldn't you do them? And the only reason you wouldn't is because you're worried about the big business interests, it seems to me, which may get in the way of common sense actually prevailing.
And on this note, if anyone would like to ask any questions, put your hand up, please, about anything at all. Parveen, I've got a thing here. I think I could.
Sheila, what a pleasure to listen to you. You've done just so much and so many good things. And I always wonder what you do when you go skipping off to better climes in Rome. Because I'm sure you're doing some excellent work there, and I'm just wondering what you were doing with the Pope.
Well, I'm going actually in about 10 days, I do. It kind of feels like I've got these sort of parallel lives that go on. There's a connection between what I do, or what I did as a clinician, and what I do and have done in Rome, which is that when I was working as a psychiatrist, I particularly focused on working with people with learning disabilities, adults, children and young people as well to some extent, but adults who had experienced serious trauma, in particular abuse. I got to know Cardinal Cormac when he was the Cardinal Archbishop of Westminster. The first time I really got to know him was because he came to visit my daughter when she was in intensive care at St George's. And he was so inspired by her that he preached about her in his kind of Christmas sermon that year. But anyway, when I became a member of the House of Lords, just before that was announced, he'd rung me up to say, would I be able to help him with the Vatican visitation to the Catholic Church in Ireland, because the Vatican felt that the Irish Church had dealt with the clerical abuse scandal so badly that they wanted to find out more. And he said, I've been asked to lead the visitation, but he said, I can't possibly go on my own. I need somebody who knows something about it to come with me. And so I thought very hard about it, and I said, well, I don't mind coming, but I'm not coming as a token woman. I mean, I didn't put it quite like that, but I said, would it be, could we have an agreement that you won't see anybody without me, and I won't see anybody without you? And he said, of course, absolutely. And it was quite important that I said that, because in fact, when we got there, we spent 3 weeks there. When we got there, I remembered the meeting with the bishops that had been set up. They said, please don't bring your assistant with you.
Oh, so you had foreseen that this could have caused
I hadn't really. It just.
Yeah.
But I mean, I suppose, yes, I had foreseen it. And he said, no, we do everything together. And we had the most extraordinary experience. There were 4 of us. We had a house, and there were 4 of us in the house. He's now an archbishop. Mark O'Toole was working with him at the time, and there was a nun, a religious sister, who helped to organise the events. But we saw people morning, noon, and night, and sitting and listening to survivors of abuse and hearing their stories was just really, really important. Met some extraordinary people. Martin McGuinness. I just interviewed all sorts of people, right? The stories I heard were amazing. Anyway, I ended up being invited to go to Rome to speak to a conference of bishops the next year. And they wanted me to talk about the experience of victims. And I said, no, I think really you should invite a victim survivor to come and talk to you. I don't think it's appropriate for you to ask me. And they said, well, we couldn't possibly take a survivor to Rome. It would be too traumatic for them, too difficult, you know. And I said, well, I really don't think that I could do this then. And they came back to me about a month later and said, we've decided that we would like you to find a victim, and could you please come together and do it together? So I found, I did some research, and I identified a remarkable woman called Hollins from Dublin. And she came to London, and we spent a couple of days just working out what it was that we would say. And we went together and we talked to the bishops, and had quite a profound effect on them. We were the only lay people, the only women speaking to them. And as a consequence, I think, we were both invited to become founder members of a commission that the Pope set up, Pope Francis set up after that. And I served on the commission for 4 years, and the work is still going on, and I will be meeting with them when I go in a couple of
When did you
weeks.
start the work with them? Was that the
2014,
2014 when you were appointed? Yeah, yeah.
Yeah, and you know, I learned, I mean, it's not the time to tell you all about it, but I mean, I met Pope Francis a few times, and he's an absolutely remarkable person. But the challenge of trying to address this is it's not just a church-related thing. I mean, abuse happens in all parts of our society. It happens in medicine, it happens in education, it happens in social care. It's very, very shocking when it happens in a faith setting, but it happens in all faith settings as well. And but in a global context, trying to develop guidelines and processes and understandings which transcend the different cultures that the Catholic Church addresses. You know, it's really quite something. You can't just take what we might be doing in England and try and transpose it to Ghana or Sri Lanka. You just can't. You know, everything has to be kind of culturally adapted.
Have you found obstacles, purposely placed obstacles on your knowledge-finding mission? I'm sure I've read about the Roman Catholic Church in Italy placing plenty of those in people's commissions. Yes,
I mean, and that's one of the most shameful things about the scandal, is the way in which kind of cover-ups took place. And I don't know whether any of you watched a film called Spotlight. It's available on Netflix, I think. It's a remarkable film, and it's about the Boston Globe Spotlight team who investigated abuse in Boston. The cardinal there was and others were accused of a cover-up. And what they did was they saw it not as a crime, they saw it as a sin. And they thought that when the person said that they were repentant and wouldn't do it again, that it was fine and they would move them to a different place. And so a lot of it was a lot of misunderstanding. But also, and I think that is part of the difficulty, that people really find it hard, especially if it's somebody you know, to believe that they could be capable of doing something so abhorrent as to abuse a child. So that awareness raising is something which is so important, and it's sort of kind of one of the things which, it's a sort of theme, if you like, that I suppose I've kind of followed, which is that you have to involve the people who are most affected, because they're the people who have the most chance of finding the solutions.
Yeah.
And so I think you know, my insisting that Mari should be there and her voice was the one that should be heard was absolutely right, because she had more chance of making a difference, to be honest, than I did.
And it was early days, if you think about holding people accountable. You know, the last 5 years we've made enormous progress, but that was earlier than that. Now,
well, there was a block. There was another block, which was that Pope Francis wanted to hold bishops accountable, but at the time we discovered there was no process actually. So the Pope has something like 5,000 bishops who he appoints. I mean, doesn't appoint them all. He appoints the ones. They are all accountable in theory to well, they're accountable to God, because they're actually they all have their own area, their own diocese, which they're responsible for. So it's quite tricky, this relationship with the Vatican, because the Vatican doesn't really tell them what to do. And they didn't have a process for reporting a bishop to Rome. And so our commission recommended 2 different possible tribunal systems. The second one seems to be working.
So they were above the law before then?
Yeah.
Pretty much.
Yeah.
Well, we could talk about this for hours, and we may return to this topic in future questions. But thank you, Paveen, for opening this whole new topic, which I was going to touch on later. Any more questions? Roger?
Thank you very much. Yeah. Well, thank you so much for joining us this evening, Sheila. I just wanted to ask you about the House of Lords. You know, and it doesn't always get the best press, nor does the House of Commons for that matter. But do you think, as a chamber with, I think, 800 or so members, that it functions as well as it could? And if you were able yourself to make any changes, what changes would those be?
So the House of Lords itself has tried to reform itself and decided that it would reduce in size to 600 members. But unfortunately, if a Prime Minister decides to introduce 250 new peers, there's not much we can do about it. And we had agreed that the way that we would go about it was that for every 2 people who left, then we would allow 1 person in. Okay? But it's quite tricky if a Prime Minister chooses to ignore that. And we're about to have more people coming as a result of the recent change of Prime Minister. If you change your Prime Ministers often enough, there are quite a few lists.
There's nothing stopping them.
So, yeah. But I think it does. I mean, it is demoralising at times to just think that there are some people there who don't really make a big contribution, but there are some extraordinary contributions made. And I think we don't get any publicity really. We get bad publicity sometimes, but if you knew the hours that we worked, I mean, over the health and care bill, we were sitting till 3 o'clock in the morning. You know, I mean, we were debating, we were voting, and we don't get a staff allowance. You know, we don't have any paid staff to help us. So it's kind of, you have to work pretty hard to really understand the bill. And of course, there are people who will advise you and charities who will advise you. But you really, to actually really understand it and to come up with amendments that are going to make a real difference. I actually achieved probably more this year than I have done, and in that bill, in part. And one of the things was I'd had a private members bill, which was to try to introduce mandatory training for people with learning disabilities and autistic people. And it was based on my experience at St George's, where every medical student was examined in clinical finals on their communication abilities with people with learning disabilities. Okay? Every medical student. The only medical school in the country, as soon as I retired, it stopped. Shame. Anyway, from the 1st of July, it is now law that every health and care professional working in regulated activities or regulated settings will have to be trained in learning disability and autism. And if they are, there are different tiers of training, but at the higher tier levels of training, this training must be delivered by people with learning disabilities and autistic people, which is what we did at George's.
Beautiful.
And the way that I did it was I had a private members bill. It wasn't going to go anywhere. And it occurred to me that I could just lift my whole bill and pop it as an amendment into the health and care bill. And I did. And the government tried really hard to persuade me that it was their intention to do it. They weren't ready yet. It was going to happen. They had some trialling, you know, and they were sure that it would happen in due course. And the day before my amendment, they rang, and a couple of days before, they rang and said, "You do realise that it's going to be very late. It's going to be very late in the evening. You surely aren't going to call a vote, are you?" And I said, "Well, do you know, I've never lost a vote. And I think I've got the support right the way across the House. So my intention is to call a vote." So the day before, I had 6 lawyers on the phone, on the Zoom, discussing with me, well, could it be tweaked like this? Well, they weren't quite sure. How could we? And in the end, the government accepted it, and I didn't even have to call a vote.
Incredible.
So,
Yeah.
I mean, it
Congratulations, but that's a major,
so much
major
work,
achievement.
so much
Yeah.
extraordinary.
Yeah.
I mean,
Yeah.
it's just so much
Yeah.
work, but really satisfying to do it. So yes, the House of Lords can make a
Yeah.
change.
Yeah.
Sometimes we're disappointed because it goes back to the other place and they go and overturn it. I can give you examples better. I can talk forever.
Well, you will in a minute continue talking forever because we want to hear all about the books beyond words, and I want to make sure we give it enough time. This is such an incredible thing that you did from 1989. This project has been ongoing, and I can safely say with over 40 titles, you
80
have
now.
80, even more. You have truly changed the lives of so many people for the better. So what I suggest is, why don't you introduce the concept before we show the brief film we've got?
Yes,
And then
okay.
we can carry on talking and take some questions.
Okay. Well, I bought one, this is one of the first ones. There were two books, when Mum died and when Dad died. And it all came about because I was working at a long-stay hospital in Epsom. I worked there for 3 years, I think, when I first became a consultant. And the first psychiatric referral, essentially, was a man who the staff wanted me to give him some medication to get him up because he wouldn't get out of bed, and he was pushing his food away, and he was beginning to self-injure. And this man had no speech, he had Down syndrome, and he was in a ward. Most of you will not have seen a ward like it, you know, with kind of like 18 inches between the beds, no personal possessions, and he was refusing to get out. And I said, well, there isn't a medicine for getting people out of bed. You need to have a diagnosis first. You know, what's the diagnosis? What's happened? What's changed in his environment? And the staff didn't know of anything that had changed. But I didn't give up. I kept asking. And eventually I found a member of the kitchen staff who said, well, his dad used to come every Sunday, but I haven't seen him for about 6 months. So I diagnosed a bereavement reaction. I said, he's grieving. And they said, but how could he grieve? Because he has no speech. And I realised just what an uphill struggle this was going to be. And so I went looking to see, and the thing is that my son, who's a man now approaching 50, but as a child, he didn't really put two words together till he was about 9, and he really benefited if we drew pictures for him. And my husband can draw, I can't, but he would draw a little sort of picture of what was going to happen. And I remember he was going on an activity holiday when he was about 7, and we drew this little picture story for him of what was going to happen. Oh. Okay, and he popped it in his pocket and went off and had a lovely holiday. And it included, you know, horse riding and abseiling and all sorts of adventure things. Okay. And that he was coming home at the end. Yeah. And that he was coming home at the end. So it started with us waving bye-bye, the coach, the number of beds, you know, the activities, not exactly right. And that has been, and I still, every week, do a pictorial timetable for him so he knows what's going to happen in his week. He doesn't read, all right, but he has a pictorial timetable so that he knows what's going to happen. So I thought, well, how about seeing if I could do that for John, this man with Down syndrome? So I looked, I couldn't find anything about the death of a parent. Children's publishers, no, too dangerous, too difficult, can't do that. And that's relevant to what I'm going to show you in the film. So we created 2 little books, and the beauty of them is that there are no words to get in the way. And we trialed them. We always trial everything we do. We trialed them to begin with by putting some simple words. And everybody who read it wanted to know what the words said. And that's not the point. The point is, what do you think is going on? Who are those people in the picture? I tried with photographs. And photographs didn't work because photographs of people, of somebody. Who is it? This one. I'm going to call him George. I'm going to call him Ted. I'm going to call her Susan, right? I'm going to, you know, whatever. Or just pointing to the figure that you relate to if you can't speak. And so that's really basically what happened. And they all include emotion. They don't shy away from what it feels like. And they kind of model good practice. So this was about death and dying. So we show this person arriving and visiting mum who's dying in hospital. And we show that. It's okay to visit. You don't have to stay at home because you've got a learning disability, because you can't talk. You can be included too. You can be there. Your feelings matter. You can say goodbye. Yes, you can be at the funeral. You know, you can actually go. It's all right. It doesn't matter if you cry. Other people cry too, okay? So we wanted to show that it was okay. So that was the first. And we've done 80 now. We're looking forward to doing one on gambling.
I hope so. But I think I'd just like to add that there's a powerful evidence base behind the effectiveness of these books, which when we were discussing, I was like, yeah, Sheila, let's do one on gambling. She was like, no, but you don't understand. This is a very serious process. It takes 6 months or a year, and this needs to happen. And when I look through the protocols, oh my goodness, I can see how special these creations are, because the work of the artist is not just let's do a little picture. It's absolutely worked on the response of the groups that you've got, feeding into the ultimate product in such a great way. I'm just going to tell them to put it on. Can you hear me, or shall I come and wave around? Can you hear me?
It's going to go straight into a head teacher talking, okay? And then you're going to hear about, because I've always said, one of my mantras, if we get it right for people with learning disabilities, we could get it right for everybody else. And what you're going to see is the book's being used by children in a mainstream primary school. So we'll start with that. And there's an evidence base going there too. So here's Georgina.
We had a significant number of children with social emotional needs. Marie Grant's experience with Beyond Words became a very important starting point to meeting the wellbeing needs of our children.
We started a little group just for children from bereavement. We called it a feelings group. And they got together and we used the books to talk through developing their vocabulary around funerals and bereavement. I realised how powerful they've been as a starting point. So from this grew out feelings groups, like book clubs, but it was more to help each other, using the pictures as a way of talking about what had happened to them, where they could talk about the characters without actually talking about themselves to start off with.
We tracked it very, very carefully, looking at their attainment, their attendance, their attitudes to learning. And what we found was all of these things improved rapidly. STATS results were above national for that year, and it absolutely paid off.
I suggest using the Books Beyond Words series that cover like everyday aspects of life, from getting married all the way through to being mugged.
A lot of the topics are about health. For example, health promotion, about health eating, sport and exercise, and also books about personal hygiene. George Gets Smart and Susan's Growing Up, which is about a young girl who's having her first period.
There perhaps sometimes is a misapprehension amongst people that people with learning disabilities won't understand complicated and anxiety-provoking subjects. But of course they're living lives that are affected by those things every day, and to have a really straightforward tool that covers in such a detailed and in-depth way often really painful, difficult to think about subjects, I think is really helpful. Because they don't have words, the most important thing is that the whole page is a picture, that the pictures tell a story. In my experience, people feel so much more comfortable with these books than books with words. They can actually take ownership, taking that book and telling you the story.
Cricket is a man's game.
Yeah. Oh, the old time.
No, I don't think cricket is for girls.
It can make a difference to people, the people that find it hard to read. Hopefully that reading that book will make them believe in themselves.
Sadler's Wells Studio Theatre and actor Hugh Grant joined his fellow cast members for final rehearsals of The Drama Group, the latest production by the Baked Bean Theatre Company for actors with learning difficulties. The drama group is the stage adaptation of a book created by Hugh Grant and Nigel Hollins. You co-authored this book?
I have. I met Nigel really through his mother, Sheila Hollins. I regard him as a good friend.
People really blossom when they are treated with respect.
Absolutely, absolutely special. Thank you for sharing that.
It was just a very rapid. We just put together a few clips for you because, but I just want to say that the teacher at the beginning, the head teacher, what she didn't say was that she started doing feelings groups because they had got the lowest SAT scores in the whole country. This is in South Yorkshire. And at the end of the year, they were above average. And they had no extra maths or English tuition. They just allowed the children to talk about what was going on in their lives through the pictures.
Thank you for sharing that, Sheila. Now, I realise we are sort of running out of time, and I can do two things. I can sort of open it up. If people have questions, that would be lovely. So let's do this first. And if there's time, I'm going to ask you about early influences, etc. But I think it's so much better to do this. You first, and then Fiona at the back, and then I'll see who else.
Sheila, that was a wonderful discussion. Of course, your whole career has been wonderful in many ways. You said at the beginning, people may not remember the old king. Well, I do. And I also remember things like Cowley Road Hospital, where the people were in the beds touching each other and so on and so forth. And a physician called Leo Woolner came and changed the thing and said old people and people like this are people, not to be discarded. And I'm sure you know that. Now, the other thing that used to go on in those days and gradually disappeared. First of all, the big hospitals where people went with nice grounds and blah, blah, blah. And then the wonderful time when I used to do moonlight with GPs, there were district nurses and district mental health nurses or psychiatric. They were wonderful. They could go out. Now it seems to me there is almost nothing. You talk about people being sent from somewhere to hospital and staying there for 5 years. Why couldn't they go back to where they were before? Yeah. Where would we go from now?
Well, I mean, I think, it's really tricky. I remember when I first came to St George's, Joan Bicknell, who was the most inspirational mentor for me, she had quite a library of books, and I always remember one of the books I read was what will happen to my child when I die? And that is always the big question that we mums and dads face. Okay, what is going to happen? And the difficulty is that unless you actually have really good family support to continue, what happens typically is that the person is admitted to hospital. That's what has always happened. And unfortunately, it is still sometimes happening because one of the studies I did at George's was to look at the bereavement reactions of people with learning disabilities after a parent died. And often their bereavement is their reaction, their grief doesn't show immediately. But it may be an anniversary which leads to some behaviour change, and people don't make a link back to the actual bereavement. And so they're admitted to hospital for disturbed behaviour, which goes back to the bit I was talking about at the beginning. If you actually look into a psychiatric unit for people with learning disabilities, and I raised this as a question, about 50% when I looked into it were people who had gone there after a family member had died, after a parent had died, typically. So there is this trouble that unless we have better community support, I created one of the very first community teams in the country. We called them CMHTs in those days. That title was taken over by general psychiatrists. So we changed it to community teams for people with learning disabilities. And when I was involved in doing that, I never actually ran an outpatient clinic. I didn't actually have any beds. I didn't admit anybody. And I remember sitting next to a surgeon at a district general hospital meeting, and we were having to look at each other's discharges and outpatient numbers and so on, and mine just said naught. And I remember the surgeon sitting next to me saying, well, what do you do then? And the thing was that I'd been a GP first, and I was accustomed to being in the community. And I was also a GP at a time when GPs still did home visits. So I used to go to where my patient was. I would go and visit my patient in their home, if that's what they wanted. Or I would go and meet them at the GP practice. Or I would meet them even on a park bench, wherever in the day centre, Get to know them in their ordinary environment, and then begin to understand what needed to change, what support they needed. And we were able to build support around them, because we collaborated between health and social care. Things are much more regimented now. It's much more difficult. Doctors are told they've got to see so many patients. It's much harder for people to, and also people are much more risk averse, I think. And so I was able to, I felt confident to be able to take risk, to judge risk. If I admitted anybody to hospital, I admitted them to a district general hospital, and I would go there to the ward rounds, and I would talk with the staff and get my patient home as soon as possible. And I had community nurses to help me, right? I don't believe that model, but it was based on relationships. It was based on knowing the people in my patch, and they're a pretty stable group. I mean, you live with a learning disability all your life. It's not like you're an older person with a chronic sort of conditions which are going to maybe make bigger demands on services for 10 years. This is somebody who's living their whole life with this condition, with this reality, this part of themselves. Yeah. And so then knowing the person and trying to make sure that their life continues as much as it possibly can, with services making the adjustments that are required to enable them to do that, that's what's needed. But it's not, and that's why it becomes so difficult when we try to regulate exactly how things should be delivered, rather than allowing for more creative approaches. Yeah. And that's why, in a way, I started the books. It's because, I didn't think the tools in my tool kit were kind of enough. We needed something which was going to work very directly with people themselves.
I've just remembered something that I'd love you to touch on briefly. The House of Lords recently had an event in relation to these books, talking about people who had arrived from other countries. Do you want to tell us a little bit? And then I'll come to you, Fiona, in a moment, just to follow on from what you were saying.
So one of my regular co-authors, Valerie Sinnison, whose PhD I supervised, and who's a psychoanalyst, and who worked with me with traumatised people with learning disabilities for about 18 years. We did group therapy together. Her grandparents had been Jewish immigrants to the East End of London, and she decided that it would be really good if we could create a story, a refugee story, really to respect her grandparents, but others as well. And she put the first amount of money into the book, which was fabulous, because it's quite hard to raise the money. And we started working with refugees and refugee organisations. And halfway through creating the book, we'd got to about 25 pictures, and I think now there are 40. But when the Afghanistan crisis happened, and so we decided to make those first 25 pictures available free on our website. And within days, we'd got the kind of guidance that went with it, translated into Pashto and Farsi and Finnish and a couple of other languages that were particularly relevant. And it was being read in a psychosocial centre for Afghan refugees in northern Pakistan, because I happened to know the professor. I'd visited the professor in Peshawar a few years ago. When the book was finished, we decided to launch it in the House of Lords. And it was quite tricky because of COVID and because I think there was a train strike on the day, and but we had about 40 people there, including some Afghan refugees who'd helped us to create the story. And there was one young man there, and he had been unable to send us any comments. He was just leaving school, but he spoke at the event, and he said, well, my mum and dad couldn't come today, but they wanted me to say thank you for this book, because for the first time since I've come here as a refugee from Afghanistan, and he'd come some years earlier, for the first time I've been able to talk about what it was like for me to leave my home and my family and to come to this country, which was kind of really quite profound. What we found though, and the launch was just, it was a wonderful event, very moving, very many personal stories, refugees in the Middle East, and the advisors we had really made that story come to life. But actually, sadly, we realised it wasn't going to work for Ukraine, because our characters were a young man and, well, you could interpret whether it was a father and a son or it was an older brother and a younger brother. Of course, from Ukraine, it's mothers and children. And so we've got a Polish artist who now works for us, a wonderful professor of graphic design, graphic art, who volunteers for us and is creating a story about Ukraine. We've got the beginning of that story available.
We look forward to hearing more about that when it's finished. Thank you very much, Sheila, for sharing that.
And one of the things actually, I'm sorry, but one of the things about it was we wanted children in school to read it, and we wanted adults in our book clubs and libraries to read it, because we wanted them to understand and to welcome people who were coming here from other countries. So we wanted our readers to understand the experience. It was designed, it's being used in refugee centres and welcome centres as well, but we wanted it also to be a source of kind of understanding for the welcoming community that we hope we provide.
Make sure we have a copy in our RSM library or two for people to see. Thank you. Fiona, would you like the last question or one of the last questions?
Thank you very much, Sheila. You've had such a fascinating, varied and successful career. And I was just wondering, looking back when you started, as a woman, maybe you were in more of a minority than you would be now, whether there were any particularly challenging moments or amusing anecdotes from being a woman doctor in a much more male world then?
Well, I mean, I can remember when I was, I wanted to work part-time because, you know, I got married just before I qualified, and I had my first child kind of, was it a week before I actually officially finished my house jobs? I worked up until the Friday night, and she was born on the Monday, and she was full-term. And it was 108 hours, you know, a week in those days. But then, and then I went into general practice, and I managed that for a little while, and I could manage my hours fairly well. But I realised that I had rather missed out on psychiatry training at medical school, and I thought that I would be a better GP if I went and did a bit of psychiatry training. And I managed to get onto a part-time training scheme. It was one of the very first part-time training schemes. But people would say to me, oh, well, you know, nobody will take you seriously unless you work full-time. And I would get introduced as, there was my consultant at the time, introduced me to somebody as a part-time married woman with 4 children, which I did have by then, part-time married woman with 4 children. And I looked at him and I thought, dare I introduce you as a full-time divorcee with 6 children? But I didn't.
Yes.
But there was that sort of prejudice, really, and a lot of it was, you know, if you want to be taken seriously, you've got to work full time. Martin, my husband, who's here, who's always been a tremendous support, we kind of alternated as to who was working full time and who was working part time.
I was a teacher, so I dashed home so she could do an evening surgery.
Yeah. Yeah, and it's lovely to have the opportunity, Sheila, actually, as we finish, maybe to give you the chance to express gratitude looking back. I know that there were some people who've been really key figures in your career or through family that you just thought you might mention, and it might be a good way to end. I'm aware we're sort of running over time, and I'd like to give you this chance to do that.
Yeah, well, I mentioned Joan Bicknell. I mean, she was inspirational, but you know, to be honest, I think I have to say that my, and my husband, I mean, has been an extraordinary support. I think because he went to a co-educational school, and so he always saw girls as his equal. right?
Yeah.
So it was kind of fine. But my father, my parents really believed that my sister and I could do something. And they never raised any doubts. It was always assumed that we would go to university.
Do great things.
And we didn't know that actually it was very unusual to go to university. The year that I actually left school, that year, a 4-form entry grammar school, there were only 3 names on the board at the end of that year of girls who'd got degrees. Now just think about that, how that has changed, right? And then the other bit was, I mean, I did really badly at school. Okay, I was head girl, and I had to do a 3rd year in the 6th because all of the girls failed A-level physics. Actually, the teacher was sacked. And
yes,
it's true.
Rightly so, can I say?
She did talk about her golf lessons, most lessons, and we'd never done any practicals. And in the exam, we were supposed to go into a laboratory. We'd never seen the equipment before. You know, I mean, but I always thought, and I got into medical school in part because I'd done VSO in Nigeria, and I'd been head of science in a girls' school at aged 18. And I thought they'd given me a place on the grounds of kind of initiative and, you know, being a bit different. And anyway, being a suitable wife for Thomas's man, because they only took 12% girls, and that was a kind of an upper, you know, limit. So, you know, but my parents believed in us. And I think when I think about how their opportunities had been so limited by the war, and my father's, you know, life career had to change because of his injuries on D-Day, and how my mother, you know, had, well, just, we moved to Yorkshire because that was a place where he could get a job that would enable him to, you know, bring up his family. You know, I think it's extraordinary, really, the opportunities that they saw for us. So I think parents are really something.
That's a beautiful note to end on, and I'd like to thank you, Sheila, for sharing all of this personal and professional narrative with us tonight. So join me in thanking Sheila.